Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Hafsa Mubin from FMDC and we are doing Unit 5 of Physiology. This is Chapter 27 and this is about glomerular filtration, renal blood flow and their control. First of all, table of specification. From this unit, you will have 2 SCQs and 8 MCQs in paper. Now, first topic is glomerular filtration. You have to prepare this topic for your SCQ. You have to define glomerular filtration. Here is that definition. What is glomerular filtrate and what is glomerular filtration and its value. These are all important points and you have to write the formula. So this is important for as a SCQ. Urinary excretion is also important for your SCQ. You have to write about urinary excretion rate. This is important diagram. Then this diagram is coming further. You have to do it from there. Next is this table is not very important. Important points are highlighted for MCQs. These are also important MCQ points. This graph is not important. These are important points for your MCQs. Next is this SCQ. How do we calculate, like what is the formula for calculation of GFR and what are the determinants of GFR. This all topic is very important, very important topic of this whole unit. You have to keep this diagram in mind while doing all of this text, and this is the formula and this is the table and the values. You have to do this. Next is the explanation of all those determinants one by one, and you have to read all of this text for your better understanding. These are very important. This is the continuation. This is the last factor, determinant of GFR, and this is very important as an individual SCQ, like how blood flow regulates the GFR. What are the effects of vasoconstriction and vasodilation of renal artery on GFR formation? This is here. You have to do this diagram also. Next is this all theory is explaining this concept. You have to read this thoroughly for your concepts, for your better understanding. Next are the factors that decrease the GFR. This is the tabulated form of all that previous text, so you have to do it from here. This is very important for your paper point of view. Then is the renal blood flow. You have to know the value of the renal blood flow. Then its regulation. The determinants of renal blood flow are also very important. This whole topic is your one SCQ. This table is not important. This is also important for your MCQ. Then is next SCQ, which is control of glomerular filtration and renal blood flow, like how autonomic nervous system and hormones are regulating the GFR. So this is very important. You have to prepare it for your SCQ. The hormonal regulation is also very important, and all of these hormones are regulating. These are very important topic, and there is another type of regulation which is auto-regulation. This is not part of your past SCQs, but this is important topic. You have to take a good concept of this topic. This graph is not important for your paper. These values are important for your understanding. Then auto-regulations and its importance. This is important for your concepts. Then this is tubular glomerular feedback and auto-regulation of GFR. This is important SCQ. It has a diagram with this, and this all text is very important. Like what is the structure of the macula densa and juxtaglomerular apparatus. This diagram and that previous text is a SCQ. You have to do this very well. Now these points are with this diagram and you have to do this diagram. It is a flow sheet and it explains the regulation through macula densa, the role of macula densa in the auto-regulation. So this is important from here. This blue box is not very important. You can leave that. Myogenic auto-regulation is not very important for your paper point of view, but it is important for your concepts. This is another blue box and it has important MCQ points. This is again the flow sheet of the role of macula densa. Macula densa has two-sided way of regulating GFR, so these flow sheets are important. That's all about this chapter. For more details and for MCQ practice, do consult Medical Globe MCQ Crack series. Stay tuned for more videos. Thank you.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and MBBS cracks at your doorstep by placing your order at 0335 66 33007.